Hey everybody, welcome back. This lesson is about the facial bones as seen in CT imaging. We'll look at the facial bones using the coronal plane. This is a coronal reformation of the facial bones. From the lower left graphic, you can see that we're very near the front of the face, just at the edge of the nasal cavity. Also notice that this image is in a plane that is roughly perpendicular to the hard palate. That's the normal orientation for coronal images through the facial bones. At this point, only a few structures are visible. We can see the nasal bones forming the bridge of the nose. We can also see the perpendicular plate of the ethmoid bone. The perpendicular plate joins to the vomer and forms the bony nasal septum. We can't see the vomer just yet in this scan. Finally, we can see the upper teeth. The upper teeth extend from the alveolar process of the maxillary bones. In the next image, we'll move slightly deeper into the face. We'll start at the top of the image. This is the frontal bone. It contains the frontal sinus and forms the supraorbital margin. That's the roof of the bony orbit. Obviously, the frontal bone is a cranial bone, not a facial bone, but it does form parts of the face. This is the ethmoid bone, also a cranial bone. It contains the ethmoid sinuses and forms part of the medial orbital margin. That's the inside edge of the bony orbit. This thin bone is the perpendicular plate, which extends inferiorly from the ethmoid bone to form the upper half of the bony nasal septum. The lower half of the bony nasal septum is formed by the vomer, a different bone. This bone is the maxilla. It's known for containing the maxillary sinus, but we can't see the maxillary sinuses just yet. However, we can see the maxilla forms the lateral walls of the nasal cavity as well as the upper jaw. This portion of the maxilla containing the teeth is called the alveolar process. This bone is obviously the mandible, and this portion of the mandible containing the teeth is again called the alveolar process. Take note of the surrounding structures and some of the injuries. This patient has a maxillary fracture. Here we see it in the maxillary portion of the hard palate. That's the roof of the mouth. This patient also has a mandible fracture. In the next image, we're moving slightly deeper into the face again. Once again, starting at the top of the image. This is the frontal bone. It contains the frontal sinus and forms the supraorbital margin. That's the upper edge of the bony orbit. This, of course, is the ethmoid bone. It contains the ethmoid sinuses and you can see forms part of the medial orbital margin. This thin bone is again the perpendicular plate, which extends inferiorly from the ethmoid bone to form the upper half of the bony nasal septum. The lower half of the bony nasal septum is formed by the vomer. This air-filled space is the maxillary sinus within the maxillary bone. This portion of the maxillary bone containing the teeth is called the alveolar process. This bone, again, is the mandible, and this portion of the mandible containing the teeth is called the alveolar process. We can also see some new structures within the nasal cavity. The middle nasal concha extends from the ethmoid bone. We can also see the inferior nasal concha in this image. These are sometimes called the nasal turbinates. Moving deeper into the face, this is a very good image to describe the bones forming the orbital cavity. The superior orbital margin is formed by the frontal bone. The lateral orbital margin is mostly formed by the zygoma or the zygomatic bone. The medial orbital margin is partially formed by the ethmoid bone. The inferior orbital margin is partially formed by the maxilla. The medial portion is formed by the maxilla, and the lateral portion is formed by the zygoma. We can still see the alveolar process of the maxilla and the alveolar process of the mandible. Inside of the nasal cavity, we can see the middle nasal concha, the inferior nasal concha, and again, we can see the vomer. Several fractures are also seen in this image. There is a fracture at the frontozygomatic suture, also called the zygomatico-frontal suture. This is the point at which the frontal bone joins to the zygomatic bone. You can see that the joint is no longer interlocked and stable. These two bones have been pulled apart as a result of trauma to the face. There's also a fracture fracture in the lateral wall of the maxillary sinus. That's why this sinus is filled with blood and fat. The fracture created an opening for facial fat to herniate into the sinus. A paranasal sinus should always be clear with air. If it's ever filled with blood or fat or anything else, that means it's been affected by an injury or a pathology. We can also see that fracture in the mandible once again. We'll again move deeper into the face. We're again seeing most of the same structures. This time we'll point out the paranasal sinuses. This is the frontal sinus inside of the frontal bone. Between the bony orbits, we're seeing the ethmoid sinuses, sometimes called the ethmoid air cells within the ethmoid bone. This image again gives us a very good view of the maxillary sinus. The left maxillary sinus is clear and filled with air. The other sinus is filled with blood and fat from a facial injury. The lower half of the bony nasal septum is formed by the vomer. Notice that this patient has a very crooked nasal septum. The cheekbone is formed by the zygoma. We can still see the alveolar process of the maxilla and the alveolar process of the mandible. We can also see the fractures previously observed. There's a fracture affecting the roof of the maxillary sinus, or you might describe that as the floor of the orbital cavity. There's another fracture affecting the lateral wall of the maxillary sinus, and once again, we can see a fracture within the mandible. Moving again deeper into the face, still in the coronal plane, now we can see some very different structures, starting at the top of the image. This is the squamous suture, which is the joint between the parietal bone and the temporal bone. This large cavity is now the sphenoid sinus within the sphenoid bone. These thin, flat bones extending from the sphenoid bone are called the pterygoid plates. This bone on the lateral edge of the face is the zygomatic arch. It's formed by the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. And of course, this bone is the mandible. Finally, one more image of the face. This coronal image represents basically the most posterior aspect of a typical CT facial bone scan. We can see the squamous suture, which again is the joint between the parietal bone and the temporal bone. Above this line is the parietal bone, and below this line is the temporal bone. The temporal bone is important in facial imaging because it contributes to forming the temporomandibular joint. The shallow recess within the temporal bone is the mandibular fossa. That mandibular fossa receives the condylar process of the mandible. On the other side of the mandible, we can still see that same mandibular fracture that has been demonstrated on previous images. Thanks for watching. That's been a review of the facial bones as demonstrated in CT imaging in the coronal plane.